Good morning, everybody. It's Dr. Brace here for Facial Plastics Friday. And today I wanted to dispel or talk about some myths associated with neurotoxins. So these would be things like Dysport, Botox, Xeomin. There's a lot of myths out there. People come in all the time saying, at my last treatment I was told this or that. Do I have to do this or avoid that? And a lot of it is not based on science or fact at all. So for all the injectors out there, the first myth is that you must reconstitute neurotoxin in sterile, non-preserved saline. I don't know anybody that actually does this. We all use preserved saline or saline with preservation in it because the benzyl alcohol, the preservative, actually acts as an anesthetic. So it does not change the potency of the product, and it helps make the injection more comfortable. The second myth would be that different products yield different results. Now, to some degree this is true, but to some degree it's completely not true because the dosing between different products is completely different. 1 unit of Botox is not the same as 1 unit of Dysport, and is not the same as 1 unit of Xeomin or 1 unit of Jeuveau. There are similarities between them, and we can kind of guess what 1 unit of Botox is equivalent to in terms of Dysport units, but they're not exactly the same because they're slightly different formulations of the same product. And so all products can achieve the same result if the correct or adequate dose is injected. And that's really the truth of the matter, is that they're all type A botulinum toxin. It really has to do with the proteins that they're complex to and how it's delivered to the nerve terminal. This is the most common myth I hear all the time. You need to exercise your face after injection. So there's no evidence that long-term aesthetic results differ in people who exercise and people who don't exercise. There's weak evidence that those who exercise will have a 1-day quicker onset of the Botox. This is only in Botox, but the duration of effect is the same in all people, and the sample size for this study was only 22 people, so it's not a very well-powered study. There was no difference in all of those people at day 14, and only one study has looked at actual masseter injection and found that treatment duration will actually be extended a little bit longer if jaw clenching exercises are instituted after injection. So the only place we have evidence in one study is that if you're doing a masseter injection, if you clench your jaw afterwards, you may get a longer duration of effect. But for aesthetic treatments of the forehead, glabella, crow's feet, there's absolutely no evidence to show that the duration of effect will change by doing exercises. The next one is that post-treatment protocols are necessary to get a good result. So I'm sure people have heard, keep your head elevated after an injection for 6 hours. There's no evidence for this. In fact, there's evidence that when you inject the neurotoxin, it is taken up into the nerve terminals within 10 minutes after injection. And so there's no real evidence and no real support to say that you have to keep your head elevated. We hear all the time, avoid pressure, avoid massage at the injection sites. No evidence for this. It's anecdotal at best. I can tell you personally, when I inject, I push on the sites because I want to stop any bleeding or bruising. And so putting pressure on it is not going to affect your result. And then the whole thing about avoiding exercise, cardio, exercises afterwards is not supported by any evidence at all. So in summary, if you're having a neurotoxin treatment, there's really no prep you have to do for it, except for come with a clean face and don't put makeup on it. If you do, we're going to take it off. As an injector, you have to make sure that the skin is sterilized. And as a post-injection treatment, really the only thing I recommend for people is a little bit of ice, especially if there's an area that bled a little bit more than another, to avoid a bruise. But you can go to the gym afterwards. You can put a helmet on. You can go to sleep, have your head down, have a nap. It's not going to affect your result. So I hope that helps dispel some myths. If you have any questions about Botox or injectables, let us know. Everyone have a great weekend.